Hello, my name is Ruth May and I'm the Regional Chief Nurse for NHS England in Midlands and East, and I'm delighted to be talking to you today as part of NHS Change Day about Stop the Pressure. Stop the Pressure for me is a very passionate cause about improving patient care and indeed supporting nurses and midwives up and down the country providing excellence of care to patients. It all started from when I came back from maternity leave in January 2011, when we really just wanted to have a conversation about how do we measure nursing care? How do we measure the care that we're giving to patients? We had a conversation about pressure ulcers and safety thermometer, and out came Stop the Pressure, something that I feel so passionate about. One of the things we realised was that we didn't have a measurement system that we could universally adopt. So we worked with Maxine Power and colleagues from Halo and developed further the safety thermometer approach. Safety thermometer has now been used since April 2012 to measure just how many pressure ulcers, as a point prevalence study, we have in Midlands and East, so how many patients have pressure ulcers in Midlands and East, and indeed nationally. What we found though is we've needed to support nurses and midwives in awareness, raising awareness, and indeed educating and encouraging and indeed celebrating the work the nurses and midwives were doing to prevent and to treat pressure ulcers. As a result of their work, as a result of your work, we've seen a reduction of pressure ulcers of 50%. We have halved the number of patients each month having a pressure ulcer. We know from patients telling us that pressure ulcers can be very, very distressing, foul smelling, very painful, and needing a lot of nursing intervention. And if 80% of those, more than 80% of those pressure ulcers are preventable, then actually we've got a lot more that we can do to improve patient care. I have been very inspired over the last couple of years leading the programme of Stop the Pressure, and particularly inspired by the event in Lincoln in the autumn of 2013. 400 student nurses came together with myself and others to learn more about what we can do to support nurses and midwives and to learn and develop their practice so we can prevent pressure ulcers. It all came about from a Twitter conversation between a very inspirational student nurse, Charlotte Johnston, and myself, where we had a conversation on Twitter, of course, discussing what we could do. Perhaps we could run a conference, perhaps we could run a study day, and all of a sudden 400 student nurses learning and developing their practice so that we can improve the care of patients. I'm so pleased also that there's been many more students' events up and down the country that the students themselves are taking this practice forward and learning through Stop the Pressure. What we have seen though the last year is a real plateau. We haven't seen the same level of improvement that we would have expected to see. Some organisations and some wards within organisations, some community teams have done extremely well, and others have really struggled to maintain that 50% reduction. Well, I believe our next step forward is to work collaboratively, to work with colleagues in NHS and with social care, working with our care home colleagues as well, to make sure that we learn from each other, we celebrate that good practice, and we network to make sure that Stop the Pressure takes the next big giant leap forward. I hope and I challenge you today and tomorrow and forever through the NHS Change Day to make your commitment, to make your pledge to Stop the Pressure.